Hi everyone, thank you for watching our video again. My name is Jess. I'm from Apple Physiotherapy. I'm a physiotherapist. So I hope everyone is doing well during the MCO period. And today I have a special guest with me. His name is Mr. Kang Loon. He's also a very experienced physiotherapist specialized in musculoskeletal health and joint pain rehabilitation. He is currently based in Global Circle Rehab in Penang. So without further ado, I would like to pass control to Mr. Kang Loon so that he can introduce himself. Hey, Kang Loon.
Hi, Jess. Hello, everybody. I'm Kang Loon. I'm a senior physiotherapist from Global Circle Physio in Penang. All right. So I
How's
have been
things
working
in
in.
Penang? Penang okay?
Oh, I must stay at home as usual.
Okay,
Stay at home, nothing to do.
Okay, can.
All right. So basically, I'm a senior physio who are working 12 years experience in musculoskeletal field. I'm also a certified CEREX practitioner.
What
And the
practitioner
certificate is
again?
so CEREX is a manual therapy. Yeah.
Okay. Too
So,
fast, I couldn't
certificate
hear.
from Europe, yeah, and also a certification in spinal manipulation.
Okay, can. So today our
So,
topic is about sleep disc, right?
yes,
Yes,
all
sleep
right,
disc. Yeah, okay, can. Tell us more about sleep disc.
okay. So, I think this is a common title everyone will see every day, huh? Whenever
Exactly,
see doctor or
exactly.
what, yeah, they will every time we have sleep this. So
Yes.
actually, the reasoning we choose this topic because it's like everyone will ask me, you really the disc is slip out from the position or not?
Mm,
Yeah.
mm,
That's why we decided to choose this topic.
sure.
So to clarify, okay, let's start with this. We go into the basic anatomy of the slip disc.
Okay.
of the disc.
Okay, sure.
All right. So from left side, you see there's a normal disc, and in center is the gel, and the external layer is the ligament. All right.
Okay.
So what happens in the bulging disc is where the outer layer of the ligament become weak, and the gel at the center part push out to the weaker side. So that's where you can see the bulging disc. So, and then with more serious cases is where the outer layer ligament is tear, and then the soft gel at the center is leak out. And when the bulging or herniated disc, when the bulge is big enough, it will compress on the nerve. That's why you have all those pain, radiating pain, or aching, soreness, or numbness, those type of feeling.
Okay, I guess a lot of us, whenever we hear normal people, when they hear about sleep disc, they thought the whole thing actually came out, and then they're worried that they will become wheelchair bound, cannot walk again, cannot do any sport anymore. So it's very scary. So by looking at the anatomy, by understanding the pathology and the problem of the disc better, it helps to release some of the unnecessary fear of the patient, right, Kang Lun?
Yes, definitely.
Yes.
And also, it's for them to easy to understand. Actually, it's not really like the whole thing easily slip out.
Yeah, that's what everybody thought. The thing come out already.
Yeah, the only thing will come out already. Oh, don't dare to do this, don't dare to do that.
Exactly. Yeah. So it's actually the water content of the disc is being pushed out, and it irritates the nerve around it. Okay?
Yeah.
Yes.
Definitely.
Sure. Okay. Wow. And looks like you have a lot of slides, huh? Ooh, very informative session today. Okay, let's move on.
So this is a common question we had for every day from our patient.
Exactly. Exactly. Okay.
So as a therapist, we can't say we push the disc back, right? Yes.
I never say that, but it is always good that when I say this thing, right? Maybe not so convincing lah. So I need to get a more experienced physio like you, and then many other physio who agree with us. We stand in one line, so it will make it more convincing. Okay, let's show some proof.
Okay, so this is an MRI. You can easily get from internet or those things. We've done a comparison. So you see, for physio, we can't really push the disc back. Even from the anatomy just now, you can see it's not really pushing the whole disc back. But from our treatment, we can reduce the bulging disc. So almost like back to normal stage. But the weaker side will always be there, but just how you maintain it to prevent it prolapse again at the disc.
Oh, Kang Lun, I have a
Okay.
question. Since the disc actually slip out, some of the content actually came out already. By reducing the swelling, did the water content in the disc actually resume back to last time?
Okay, so it depends the herniated level. If it separate from the original, the main of the water content from the gel, right? So it's an individual already, like a small water retained in the spinal cord area, right? Over time, because of lack of nutrient or those things, the thing will gone.
The thing will gone.
You can see. Yes.
Hey, what about with
Because
proper rehab and exercise? Is it possible that the exercise will actually provide more nutrient to the area and then it helps to grow the water content? Yeah, it grows the water content.
Yes. So we have to look at, because when we don't move, right, the whole joint becomes stiff, the muscle become tight, and then eventually you have more pressure on the disc. So when you move all those things, right, you alter the disc pressure. That's why you may change the pressure inside and then you become normal again. But the question is how long it takes. That's very individualized. We can't really tell how long it takes to go back to normal.
Hey, Kang, do you have any experience where patient they have MRI before treatment, and then after treatment, as the symptoms got better, they go back for MRI to look into the disc again? Do you have patient like this? Not really,
not really. That's why we can't tell. That's why you have
exactly
to go for those people who done the study.
Because it's costly to do MRI, and then as long as the symptoms got better, and not many patients actually go for another round of MRI after the symptoms got better.
Who like to do that? Go inside the big machine and it's so noisy.
And it's so expensive, right?
Yes,
yeah.
Expensive.
So so the summary is we don't really push the whole thing back, but by doing some rehabilitation exercises and some manual therapy, sometimes it helps to relieve the pressure around the nerve tissue. And then it actually helps to to improve the symptoms of the patient. So a lot of time, patient look at the scan, they thought, oh, the only thing that happened in the back, the only structure they have in the back is the disc and the nerve. They forget about the bone, the ligament, the muscles. Yeah, they completely forget about this. So we actually work on the muscles and ligaments and the movement of the joint to achieve the effect. Okay. Sure. Okay.
I still have the slide of MRI.
Okay.
So you can see the difference before and after for those people who done the study. See, there's changes there.
Yeah. So what kind of treatment they had for this group of people?
Some is manipulation. Some is traction.
For
some
how long?
Exercise.
For how many weeks?
They didn't say much about that.
They didn't say much lah, right? Okay. So don't worry, all of you here, patient, you don't have to go for a second MRI, yeah, because we got this MRI because they do research. So the volunteers get to do MRI. Yeah. Right. There is some changes. Sure. Okay. Can.
Right. So I think this one people will always ask.
Also. Yes. First thing they come to office. Actually, why like this? They will ask why.
Why? Yes, why I have this problem?
Yeah, I don't know why I got this problem. Why suddenly got this problem? I do nothing, They say, no, I do nothing.
Just sit there and then come out and then I had a pain.
Suddenly I sit down, I get up, then got pain already. I don't know why. Okay.
Okay. First thing we look at posture at these days, sedentary lifestyle. Or else is the working hours in the office. We sit there for a few hours a day, or maybe up to 8 hours a day without moving. Yeah, usually we look in this portion, right? We look at it's a static position that we don't change, that increase the pressure of the disc and the spot. That's why I have problems. in sitting or standing. So standing, some people because lazy standing, they sway their back or those things,
Yes.
we lock the whole joint. Yeah, that's a lazy standing pattern. Those will also increase the pressure on the disc over time.
Mm. Mm.
Well, for lifting, hard to say, lifting.
Lifting.
Yeah, lifting movement, back posture and lifting, depends your problems. For example, if you people always say, okay, bend the knee and then the spine straight and then you lift the things from the floor. But if for people who have knee pain so hard, or hip pain so hard, they cannot bend so much, like they have to train the back already. So hard to say which is bad, which is good posture and lifting.
Yeah, because
So it
sometimes
depends on
nature of work, some people, nature of work, they have to do all this. They can only modify it, but they may not be able to stop doing it now. No choice, huh? Okay.
Okay. So the second one is aging related.
Aiyo.
Yeah, aging related. So when we get older, the disc or the water content is degenerate dehydrated slowly over time and then the structure, the ligament also will become like weaker, easy to get tear. Like just a simple action or movement, you get twisted or get strained. Yeah, so that's why age also is a factor. But how old you can get this type of problem, it depends on individual also
Yes,
like
yes,
how stressed in the back. Some people very young, they get the degenerate disc already.
Yes.
For example, I see as young as 20 plus, I think these days become.
Neck or lower back?
Both also have.
Both also have lah.
Lower back sciatica, guy who have sciatica nerve tension at age of 25, 26 already.
Because nature of work, huh? Is it because
He just started working. He just started to work.
sometimes
So
I cannot. I say you suay xiao. I say suay lah. Maybe you
really,
suay.
really don't know. Sometimes really depend on that. So yeah, wear and tear over time. Okay, so I look at the overuse or repetitive movement in the same direction, which means more related to the work-related injuries. Like some people have to always bend forward, pick up things from the floor, or turn to the same direction every day when lifting. So most people have more high chances of get injuries of this slip disc because always stress on the same spot of the spine. And then the last one we look at trauma, which categorized into had a fall, had an accident. Yeah, those things also may cause a slip disc.
But usually with trauma, it actually comes together with other problems, not just slip disc. And also not just slip one level only. It will happen in multiple levels of the spine, and also it comes together with other trauma injury, maybe crack in the bone, fracture, and also
also in like for example, if trauma, yes, multiple level, also over exercise or like some people like crazy exercise a lot of hours, so maybe chances of multiple level of this degenerative compared with those people who sedentary lifestyle right, they always have single level or degenerative.
Yeah, so for those of you here during MCO, don't overly work out. Yeah, be careful. I always tell them moderation is the key. Too much of anything is bad for you. Okay, too much of anything. If you don't, yes, if you don't exercise at all, it is bad for your health. If you over exercise, it's also bad for your health. Yeah, so in the middle, just nice. Okay. And just to top up what you said, right? Because according to some research people, they actually talk about the pressure of the disc in different posture, sitting, standing, lying down, and then the sitting and forward bending, the pressure in the disc is the highest. Am I right? Depends on the position, body position, especially forward bending position. So that's why you see a lot of people when they are required to sit for long hours, or they're required to bend down very frequently. These are the people who has who get sleep disc, higher chances of getting sleep disc. So it's the body position.
On the spot. Keep pressing on the same spot.
Yeah,
that's why move is the best way.
Yes.
Move.
And also just now you share us the slides, right? You already, it's water inside. So imagine if you sit forward at all time, the water in the disc is going to be pushed backward. And then if you see the 8 hours like that, yeah. So thank you for showing the picture. If when you sit, right, the disc, the nucleus pulses. It's actually like water-like structure. So if you sit and bend forward, the water will be sort of being pushed backward. So imagine the water is being pushed backward for 8 hours a day, and then 28th day over work, over the month, over the time, of course the ligament around there is weakened because it's being stretched all the time. So and then one day it will just pop, came out. Yeah. So
that's why some people have a like pops after a sneeze or cough.
Yes.
That's a sudden incident.
Yes,
because there's some changes there already.
Yes, because their nature of work, already weakened the disc over the time, and then one day a strong movement like sneezing, coughing, or heavy lifting, we just push the disc out. Okay.
So yeah, we look at our management as a physio.
Yeah lah. Patient will always say, "Hey, you don't push the disc back, ah." So what do you do, ah? What do you do actually? Because my problem is my disc come out, you know.
Yeah, they always ask this question. Always have a magic to push it back or not.
Okay, you're not pushing it back.
No. We try to alter the disc pressure there, change the disc pressure to reduce it. Okay, so how we decide on the treatment plan is we need to check and then see what's the problem we have. Because like for people who are very stiff, definitely I will go for manipulation first. So to reduce the stiffness of the joint.
Yes.
Or yeah, if you identify after that you help them reduce the pain, then there's some weakness, you have to do some strengthening. If there's some tightness, then either we do the soft tissue work or stretching exercises.
Okay.
These few things we will do.
So for those people, if you don't know what is joint manipulation, that means our spine has 5 levels. If you're talking about lower back, we have 5 levels of spine, and then we have this in between each level of spine. So when the spine, the 5 levels of spines are stiff, they will increase the pressure of the disc. So joint manipulation, it's a treatment technique that loosen and make the joint less stiff, and then it helps to reduce the pressure around the disc.
Yes, definitely. So, and we also look at movement impairments, which means some people after the injuries don't dare to bend forward. They already have their mental block, we say. Bend forward will have back pain.
Yeah, they've been told not to bend actually sometimes.
Yeah. So I have clients who like that, he's not bending forward like for how many years? 5 years, 10 years?
And then?
So we have to train the movement. Have to slowly train the movement back. Because if the moment you need to bend forward, you had injuries because you lost the movement control already. And the joint also become very stiff over time. So we really have to train up the movement.
Yes, because like if you are talking about normal body healing, whatever that injured or like this, they should be recovered in about 6 to 8 weeks time. Yeah, 6 to 8 weeks time. So in 6 to 8 weeks time, if your symptoms doesn't get better, because some people when they have back pain, the pain is like, oh, you know, I have this problem for 5 years, 3 years, or even 10 years. But the body actually can heal the injury or soft tissue injury in 6 to 8 weeks. But why are these people having the pain for so many years? That is because, like what Kang Lun said just now, the movement are not correct. Yeah, bending forward is a movement that we supposed to do and every human can do. So when you first got slip disc, when the pain is severe, of course we don't ask you to bend, but after some times when the body recover already, you should start doing some bending movement. Yeah, because if you don't move at all, the pressure around the spine is very high. That's why the symptoms is always there. Yeah. Yeah. Correct.
Move. Yes, after recovery to move. But some cases, right, the nerve pain may last up to 6 months.
Yes.
But not pain, like a numbness or those tingling sensation. occasional pain runs down up to 6 months or even 9 months, depending on individual.
Yeah. But in general, by about one or 2 months time, usually the pain will be not as bad, and then you should start doing
You should be able to
some.
function already. You should
Yeah,
be able
you
to
you,
function already.
you should be able to function. If you're still not functioning, that means maybe some of the body is not moving well. So you have to seek help lah. Okay, not to say 1 or 2 months will recover, but by 1 or 2 months, the pain should go down quite okay already.
Okay, and then we look at traction.
Hey, I noticed you put question mark there. Why you put question mark?
Yeah, so it depends when you do traction. Some people
Ah,
works and some people don't works also same thing.
ah.
So like for elderly, sometimes doesn't work that well for traction. You know why?
Older generation.
Yes, of older
Uh,
generation. Yeah, because
mm, mm,
when we track, right, we try to increase reduce the disc pressure, right?
yes.
But the problem is elderly, they are especially those degenerate very badly. They don't have water content there anymore. No matter how you track, it's still the same because it cannot increase much already. For younger
Mm,
generation, it looks better because the water content is there.
mm. Kalun, if there is no water content, isn't it the
Mm.
traction also increase the space between the maybe the joint and the nerve?
But the
Even
problem
the
is when you let go, the pain will come back again.
Oh,
Ah,
so that means the effect is not long
well,
lasting.
so that's why the outcome not as good as the younger one.
I see. So what you mean is if the younger
And
one,
also,
mm,
and also depend on how they get injuries.
oh,
Protrusion types, yeah. So
mm,
they have hard protrusion of this or soft protrusion of this.
mm, mm,
So like
mm,
soft protrusion is like you gradually develop the pain over time. Like for a few weeks time, your pain gradually increase. Those
mm,
cases may works well on traction, but those are suddenly they
mm,
have like movement and twisted, then they have
mm,
some pain sciatica,
mm,
and then the
mm, mm.
movement totally reduce lah, cannot bend, cannot lose it. Those cases may work well on manipulation. So it depends on how they get injuries also.
Nature of injury. Okay.
Yeah.
Yeah.
So that's why I question mark traction, not for everyone. Depend on how you get
Yes.
injury, age,
Yes.
and things to consider. And also if too
Ah,
painful, you go to traction, wow, you will
because
also suffer it.
because there are places where they see people with slip disc, every slip disc patient, they put it to
Yeah.
traction.
Yes.
So because they don't really classify, okay, which are the group of people suitable for traction and which are the group of people is not suitable. That's why some recover, some did not recover. Yeah.
Yeah.
And then you may
Yeah.
heard your friend, oh, my friend got sick this, he go to this place, he got better, he had traction, but when I go there, it doesn't help much. Now, that could be one of the reasons. That's why
Yeah.
a very
Mm,
careful assessment by a physiotherapist, it's very important. Yeah. It's not so much on the what are the treatments that
mm.
can help, and also it's the assessment is also very important.
Yeah. So we need to assess and then tailor a treatment program for the
Exactly.
individual. Yeah.
Mm.
You cannot just like one condition, this condition can mean must do this type of treatment.
Yeah,
It will
especially
be
for
like that.
some patient when they call and inquire like, hello, I have sleep this, what do you do,
Yeah. Yeah.
what do you do, because to be honest, I
I need
can
to check
tell
first.
you. I say, we usually people sleep this, will be benefit from ABCDE treatment. But
Yeah.
before we talk about treatment, then they ask, oh, how many times I need to come? You got package or not? I say, no. We have to talk about assessment first. You come for assessment first, yeah. So always very important. Go for assessment first. Okay.
Yes. Need to identify the main problem lah. Need to identify.
Yeah
And we
lah,
treat.
must identify first. Then only we can tell you what kind of treatment is suitable. Okay.
Okay. Oh, I missed out one.
Oh,
Electrotherapy.
you never put that? Why I never put?
Yeah, miss out already. Electrotherapy.
Okay, electrotherapy is a bit controversial. What is your view on electrotherapy?
Okay, I only put when people in real pain, which I can't touch.
Ah, ah.
Then really you put electrotherapy to reduce the pain first.
Normally,
Because
if this kind of patient, they have a lot of pain, if they did not see a doctor, do you normally ask them to see doctor and maybe get some pain medicine?
Yes.
You advise them, right?
Yes.
What if they
Or
ask
some people don't want to see doctor, right? They say need to wait very long, right? And you just sometimes just go see pharmacy, get some mild pain control medication.
Because a lot of people, they are so scared of painkillers, right?
Yes.
How would you advise them in terms of painkillers if they're
Well,
scared?
we are not taking long-term medication, so it should be fine. It's not like we need to take the medication for 1 month, 2 months. That's different story. But for painkiller, anti-inflammatory medication, it's just a couple of days, 1 week, and then we see how the pain goes. Yeah, because with physio and medication, right, sometimes it works better this way.
Yes. Because if you're in too much pain, the physio can't really do much. Yeah, because ask you to turn on the bed also cannot already. Ask you to sit also cannot. So it cannot. Yeah. So it's not to say don't want to take pain medicine at all. A suitable amount of pain medication combined with physiotherapy treatment works even better.
Yes. That's why those very painful one should seek for doctor first.
Yes, if you're in a lot of pain, must see doctor, bring down the pain first. Because if you cannot sleep because of the pain, it's hard.
And then the next day morning, even worse if you cannot rest. For example, the whole night you cannot turn, you cannot do this, and the next day your muscle will be more tight, you'll be more pain.
And very important point is sleeping. It's very important for any form of body recovery. Sleep and rest, so your body can repair only if you have enough rest. So if your pain is affecting your sleep, you must have proper pain medication to make sure you're able to rest and sleep well.
Now next one, last.
Come before I have one more question. Sorry. What about patient come to you with sleep disc symptoms? They ask you, do I need to go for MRI? What will you say?
I will check first and see the severity. So if like very severe one, like very weak, no strength, when I check muscle strength, then likely I will just ask you to see doctor already.
You mean like a myotome lah?
Yeah, we're checking the strength level, like the ankle, the foot, the toes, like no strength. And then, so those cases, I like ask him to see doctor immediately already. Like for just pain, right? Then we check for it. And then if, usually I won't immediately ask him to do MRI. Unless it's very severe cases. Like I tell you, the strength level is gone and those things. If just mild numbness or pain, usually we try the treatment for a few sessions first. If a few sessions there's no changes, likely you need to see doctor for advice already.
Your few session is in how many weeks time? Once a week?
Normally, right, I look at 4 or 5 sessions. You can see some changes. I mean,
how
changes,
frequent?
not fully.
How frequent?
2 times per week. 2 or 3 times per week.
Twice a week for okay. Okay, fair enough. Yeah.
Yeah, because if no changes there for 3 weeks already, then you have to see doctor already. Why? Maybe you can consider the medication if the patient not taking medication. Or else need to do some checking when how severe is the tear or those things. Prolapse. Then we have to judge better like that the treatment.
Because not everyone have the privilege to get MRI. And then
well, there's some people who want to know more. I mean, they ask me, and then if you want to know more, and then you don't mind the MRI, go ahead.
Yeah. So, but not every time you must take MRI. Not every time. There be special condition.
Even some doctors don't ask all the patients take MRI. Some you just say take MRI when you really very bad or really think of possibility to do surgery level.
Yes. To check lah. Because the usual way would be if you have pain, even if you see doctor first, doctor will do a conservative treatment. Conservative treatment means no surgery. They will give you medication and then they will refer you to physio, because physio is considered conservative treatment.
Management.
So usually, I think research say about 6 to 8 weeks, right? At least.
A minimum lah.
Protocol. Their protocol minimum 6 to 8 weeks.
It depends.
Depends also, right? Yeah.
Depends also. That's why if I judge around by 2 or 3 weeks, should have changes. The pain should be reduced, reducing, not fully recover definitely.
It's
Reducing
reducing.
is
Must
the movement
respond
is
lah.
better. Yeah, must respond lah. If no respond, then
Yeah. Yeah. Yeah, because
yeah,
you must tell the patient like, you know, you have to see 2 to 3 weeks time. If no response, then I must see doctor. Must go
yeah,
back to doctor. No? Don't want to waste
yeah.
patient's time, man.
Yeah, time and money actually.
Yes. Yeah.
Time and money.
Okay. Okay, can continue.
Okay, so we try to achieve with our treatment.
In case
So
for
we do
those
all
of
the
you who don't know how physio works by not pushing the disc back.
yeah. So we reduce the through manipulation or soft tissue work. We reduce the stiffness of the joint, muscle tension, and then we reduce the pressure on the disc. And the traction definitely will also reduce the disc pressure. All right, and then after that, eventually we'll reduce the pressure on the nerve and then reduce pain.
Sure.
So exercise and retrain the movement will reduce back to reducing the joint stiffness and muscle tension. So same thing to how you maintain up your back.
Yes. So for those of you who don't know how actually exercise can help with sleep days, because our bones, our joint muscles, they are designed for movement. They are meant to be moved. But unfortunately, due to our lifestyle at the moment, we usually confine in one position for too long, and they are not being moved. The blood circulation and the nutrient that goes to the joints are not as much. That's why when they're injured, we have to encourage you to do exercises. Of course, not the very very hard exercises, simple exercises to move the spine in a minimal pain condition helps to reduce the pain. Okay.
Yeah. So that's why exercise is very important to prevent.
Don't do any kind of exercise, because some people they injured during exercise, so they're so scared to do any exercise anymore. Yeah.
And some the other way around. They when pain they go for internet and look for what exercise they can find on internet and they just do it. That also another problem. That's another problem.
Okay, so I will tell them actually, you can find any information from the internet, but how do you know whether it's correct or not? That's the problem. You can find, but you don't know it's correct or not. You don't know how to filter.
Yes. So you don't know whether it's this too much for you, or should you stretch it, or shouldn't you stretch it?
Yes.
Because some cases come in, right, they tell me, oh, initially they have little pain, but after they do the exercises, they have more pain by just following the exercise from the internet.
Yeah, I said that, and then the exercise is general. It's not specifically for you, so that's why it may not work for you.
Yeah, I need to check off. That's why we need to look at what's the problem you have first, before decide on what exercise you can do. Yeah.
Wow, so fast! We already 30 minutes in the interview. Okay, let's
do the last one already. How to maintain, prevent recurrent back pain faster.
Prevent. Oh yes. Sleep days, right? I noticed the recurrent of sleep days is very high. Do you notice that as well, Kang Lun?
Yes, very high. That's why I have to maintain up. So exercise have to do lifetime. Not after recover just stop. Not recover just stop.
Yeah, and also even those people are after they have sleep days, because some people when have sleep days they go for surgery, right? And even after surgery, I still see lots of recurrence of sleep days. Very common.
Because they don't do exercise to maintain the muscles. Because surgery we change the structure so that we remove the disc or those things, right? But the muscle, you don't train it up, you still will very tight, those things.
And of course the posture as well.
So, and body weight depends. If you are very big size, you reduce definitely the chances will reduce that. But if you are thin already, then there's no much changes for you. So unless you are very big size, then maybe chances of reduce this pressure is very high. All right.
Okay. Good posture. Oh, okay. Go back to the previous slide. Good posture. Define a good posture. Because sometimes people actually they come and tell me, ever since my last sleep days, I already have been maintaining good posture when I sit, but I still get this. I don't know why. I'm very frustrated. How do you tell them?
Okay. Good posture,
Hmm.
but you still have to move. If you see good posture for
Ah,
5 hours a day, it's still the same thing.
exactly. So,
You have to
because
move.
good posture, they'll be, oh, I sit straight, I don't
Okay.
slouch. So actually, the more important point is keep changing the position.
Yes, keep
Yeah,
changing position.
a good
Keep changing.
posture, an ideal posture can make you sit longer with less pain,
Yeah.
but it doesn't mean you have to stuck
Need
there
to do that.
all the time.
Yes.
Huh? You
Yes.
still have to
To be
move.
dynamic.
Yeah,
Mm.
the key is move. You can sit in
Yeah.
bad posture, but as long as you change the posture frequently. How frequent you advise them to change, Kanrun?
Wow. Usually I say less than around 1 hour.
Yeah,
Need to move
every
already.
hourly. Yeah,
Have
I
to
mean, no need to move and get out of the house lah.
just,
You just
just
have to
turn the
change.
body, the neck.
Yes, yeah. Just change the way how you sit only. It'll be
Yeah.
good enough to relieve the pressure in the disc already.
Yes. Yes. Definitely.
Exercises. Okay, when you talk about exercises, specifically what exercises? Can you
Depend
tell
on
more
the
example?
exercise you do by your therapist. Depend
Mm,
on individual, right? Yeah.
mm,
So there's no
mm,
general exercise because now we are preventing recurrent pain. So definitely have a set of exercise from your
mm,
therapist, right? So we have
mm.
to follow the exercise
Yeah,
to maintain up.
and also some research also showing a general aerobic exercises also helps.
Yeah, movement. But that one is
Yeah,
to depend how much you recover.
yeah lah,
Yeah.
yeah. After lah.
How
Not to
much
say
recover.
during acute pain.
How
Yeah.
much recover. So
Yeah.
some cases like they quite bad already, so they can't do those high impact activities like jumping, those things. Some people cannot do. Yeah.
Brisk walking
Like
okay lah. Brisk
yeah, walking
walking.
also, yeah. So
Go
also
walking,
depend on the
cycling
severity
okay.
of the severity.
Yes.
Severity. Well, I saw exercise also like people after that they go for yoga, pilates, those stuff also can.
Mm.
But for me it's just whenever you exercise, just follow your body, don't need to force.
Mm.
Yeah,
Mm.
like for example, people do cobra, they try to force all the way back.
Oh,
I mean, you
uh,
follow your body. Yeah, if you have injuries before, right, try not to force.
listen
Always
to
listen to
your
the body.
body.
Yeah, listen to your
Respect the
body.
pain. You have to respect the signal the body tell you. Okay.
Yeah, not fight against it.
Mm.
Yeah,
Yeah,
against it
don't
you
go
suffer
against it.
later.
No point, no point.
No point, no point.
Ah, okay. 34 minutes.
Okay, good. All
Almost come
right.
to the end. Oh.
Yeah, the
Ah.
end already. All right. Okay, thank you for the session.
Okay, thank you, Kang Lung, for your information. So I think this video it's not only suitable for people with sleep disc who still find they don't understand sleep this much, and like some physio, if you have encounter like patient asking you question about sleep disc, you can also refer to this video, and maybe you'll find more ideas in how to explain to your patient better, so that because education plays a very very important role in terms of managing sleep disc, yeah, because we have to prevent and make sure there is no unnecessary fear disrupting the recovery process, yeah, because the fear plays a very important role in chronic pain.
Mm,
Mm.
yeah.
Okay, so if you have any question that you need to clarify with Kang Loon or me, feel free to put your question under the comment section and then we will reply you. So if you are based in Penang, and then if you need some help in terms of clarifying your problems, you can go to a Global Circle Rehab, look for Mr. Kang Loon. But if you're in Cranberry, you can come to Apple Physiotherapy Center. Yeah, you can look for me or you can look for other physiotherapists. Yeah. Okay. Anything you want to talk about Kang Lun?
I know, that's all enough.
That's
Too
all.
many info already. I think should be enough.
Yeah lah, yeah lah. Too many info, right? Okay.
Yeah.
If you have
Them to
question,
digest.
you comment lah, and then we will come
Yeah.
and look for you and reply you. Okay.
Okay. All right.
Okay. Bye bye. Thank you for
Bye.
watching.